Hi everyone, good morning. Hope that all of you are safe at home. What are the things that you are doing now to stay safe? We know that, all of us know that, all of us stay at home now. Our governments have advised us to stay at home to stay safe. Countries all over the world have governments which are advising people to stay at home. What does it show? It shows the concern of governments regarding the health care of people under their care. Do we experience this concern of governments only when government advises its people? No, it is not like that. Governments do a lot of things as part of taking care of health of people under its care. So let us try to learn in detail. The name of the second chapter in your civics textbook is Role of Government in Healthcare. Hope that all of you are ready now to learn. So let me explain things. Children, our governments spend a lot of money to take care of health of people under their care. Here what you can see is the newspaper report which was published by the Economic Times. What does it say? See children, may I tell you one more thing? This is the report which was published on July 5, 2019. Government decided to spend 62,659.12 crore rupees to take care of healthcare of its people. So that much care is there, concern is there for the part of government in taking care of health of people under the care. Now you have seen that our government spend a lot of money to take care of health under their care, but unfortunately, the fact of the matter is, health care in India is not available to all. Having said that, let me tell you what Constitution tells about right to health. Constitution says right to health is our fundamental right. Provisioning health care is unequal. There are many ways in which the situation can be changed. Sorry. Governments try all these ways to ensure healthcare to all. Let us try to understand what are the things that governments do to ensure healthcare next. Health means ability to remain free from illness and injuries. There are many factors which influence health. Availability of clean drinking water and pollution free environment are some of them. You know, there are more than 6 crore people in India who live in slums according to 2001 estimate. 6 crore people of India were living in slums. You know, slums are the areas where the poor people live in cities. More than 55% of the population of Mumbai, the commercial capital of India, such people, more than 55% live in slums of Mumbai city. So how can we ensure pollution-free environment to such people? Adequate nutritious food and being able to be free from mental strain are some of the other factors which influence health. Let us try to analyze some of the strengths and limitations of India as a country when we try to provide healthcare to all. Our strengths include these things like India has the largest number of medical colleges in the world. There were only 2,717 hospitals in India in 1950. The number grew to more than 18,000 in 2000. India gets a large number of medical tourists from many countries. They come for treatment in some of the Indian hospitals, which are considered among the best hospitals in the world. India is the fourth largest producer of medicines, and in some of the cases, we are even exporting medicines. But our limitations are also the most doctors settle in uh, urban areas, people in rural areas have to travel longer distances to reach a doctor. About 5 lakh people died from tuberculosis every year. About 2 million cases of about 2 million cases of malaria are reported every year. We are not able to provide clean drinking water to all. 21% of communicable diseases are waterborne, for example, hepatitis. Half of our children in India do not get adequate food and they are undernourished. So everybody knows that prevention is better than cure, but we are not able to act accordingly. India has experience in running public healthcare system. What is this public healthcare system then? It's a system of hospitals and centers, health centers, hospitals and health centers run by the government. Our public healthcare system has the ability to look after the health of a large section of our population, which is scattered over hundreds of thousands of villages. But unfortunately, in the middle of all these things, we face many challenges also in providing better healthcare to people of our country. We are not able to provide proper healthcare facilities to people. Our country has the money, knowledge, and people with experience, but cannot make the necessary healthcare available to all. While explaining this module, I had told you that the right to healthcare is a fundamental right of Indian citizens. But sometimes the health of people of India is not taken care. Hakim Sheikh, you can see him on the left side of the picture, working in field, was a laborer in West Bengal. He suffered head injuries in an accident. He was taken to eight government hospitals within 14 hours, but none of them admitted him. Later, he was admitted in a private hospital where he received treatment. But in private hospital, we had to pay money for getting treatment. He spent a lot of money on his treatment and he became angry and upset over the indifferent attitude of all the hospitals that refused to admit him. He finally filed a case in the court. Hope that all of you enjoyed learning and understood the lesson. Now let us revise. Here are some questions for you. Please try to answer them. First question is define health, and the second one analyze the challenges which we face in health sector in India.